Hello, I'm Dr. De La Paz at Olean Dental Studio. Today we're going to be talking about dental crowns. So one of the questions that I get from patients is, what would you recommend a dental crown? When is it that I know that I need a crown? Well, there are different things that allow us to determine that the crown is the best way to go. Generally speaking, if a tooth is too destroyed and majority of the tooth structure is gone, at that point, if you want to preserve the tooth in the mouth, the best way to go about it is put a cap on top and cover the entire tooth. Because that way, when you're chewing, those forces from your chewing are being spread evenly and you don't damage the tooth even more. Another time that we recommend a crown is when the tooth has a large filling that occupies, let's say, 50 or 60% of the tooth, and then the rest is just not enough to hold on to it. That's a tooth that has a high tendency for breakage. With those forces, when we bite, they can break off. And so at that point, we also recommend putting a cap on it or a crown, which is the same thing. That way we protect that tooth and avoid the tooth from needing further treatment down the road. So with that being said, I get this question, can front tooth crowns look natural? And the answer is yes. There are different materials out there that we can use in order to give you a natural looking smile. And the way that we prepare the teeth for those crowns, the materials that are used to restore those teeth, all of that is taken into consideration, so when we're restoring your smile, it looks as natural as possible. So a question that I get is, would I need a crown after root canal? And the answer is yes. So it's recommended after you get a root canal to get a crown, because once a root canal is done, that tooth is not as strong as it used to be because treatment was done inside the tooth. So now we need a coverage outside of the tooth in order to prevent that tooth from breaking. I've seen a lot of cases where patients get root canals and they never get the crowns, and then after time goes by, they tend to fracture those teeth. So those teeth are starting to break, and then at that point, all the money, time, and that you put into saving the tooth with a root canal, it's gone, because if you never put a crown, then that tooth breaking and reinfecting, probably you're gonna lose the tooth. So it's better to put the crown after you have the root canal to preserve that tooth and prevent it from decaying and from breaking. Another question that I get is, can my kid have a dental crown? Well, it depends on the age. So every age has different ways of treating this. If you have a small child, sometimes the pediatric dentist may recommend a dental crown, but that crown might be a silver crown because it's on a tooth that's gonna fall out and they're gonna then get the adult teeth. If it's a front tooth on a kid, maybe the pediatric dentist might do a crown that looks more natural. It depends. Now, generally speaking, kids, yes, they can get crowns. It all depends on what stage they're at, what age it is, what tooth it is that we're dealing with, and then at that point we can make the best determination possible. One question that I get, and it's super common, is this painful? Is it painful to get a dental crown made? And the answer is it shouldn't. It shouldn't be painful, because that's why we have anesthesia. We can get your gums numb, your tooth numb, and work on it, and you'll be comfortable throughout the entire procedure. So it shouldn't be a painful procedure. If you ever feel any pain or sensation during the appointment, just make sure that you let us know. That way we can put more anesthetic and you feel more comfortable, because having pain during a procedure is not something that will make you feel comfortable, but also it's something that will stay with you forever, and it will create kind of a trauma. So then you're not gonna be wanting to go back to the dentist, and you're gonna have this misconception that the dentist is painful, when it shouldn't. So make sure that you have a good conversation about your fears, your concerns with your dentist. That way that can be taken into consideration when treatment is rendered. Very common question that I get is, how long does a crown last? Well, as long as you take care of it and it doesn't get decay underneath it, it can last many decades. I've had patients that have had crowns for 40 and 50 years in their mouth with no problems. I have other patients that they get crowns and they only last a couple years or 5 years. The crown itself is not gonna break. It's your tooth underneath that requires attention. So when the crown meets with the tooth, that area needs to be cleaned properly. So this is an area that we need to brush and floss and comb for your maintenance so we can keep everything clean and bacteria out of the area so that you don't develop decay. Because if decay develops, then the crown needs to be replaced. But other than that, if you have excellent oral hygiene, you go to your recare appointments, and you're on top of your brushing and flossing, then you should be okay for many decades. So now you have a crown, but out of the blue you have pain underneath it. What do? Well, there are a couple of scenarios. If you just had a crown placed and you have pain, depending on the type of pain, you can just need a bite adjustment. It might be as simple as that. Make sure the bite is comfortable and the pain should resolve. But if that's not the problem and the bite adjustment is not, resolving the issue, and you continue with this pain, this throbbing pain is something that lingers, that keeps you up at night, that doesn't go away, that means that the tooth didn't recover from the procedure, which happens sometimes, like 10% of the time. Then at that point, that tooth might need a root canal, which can be done after the crown is placed. It can be done through the crown, and then you just need a small filling on top. So depending on the type of pain that you're experiencing, then that's when we either need a root canal or we just need other type of adjustments to make the crown feel comfortable in your mouth and the pain goes away. You might be thinking, and how do I know if I need a crown? Well, it's kind of hard for you to know. First of all, we don't really look in our mouth and know immediately what's going on. So just make sure that if there is something that's going on with your mouth, you go to the dentist as soon as possible and take a look into it, because the dentist is trained to take a look in your mouth and diagnose and be able to tell you whether a filling, a crown, extraction, whatever it is that you need. So we'll be able to explain to you, show you photos, and give you alternative of treatments that then will lead you to either getting a crown or something else. But we don't expect you to know at home that you need a crown. Just come to us, we'll take care of you, we'll diagnose and explain everything and make sure that you feel comfortable throughout the entire process. And if you do need a crown, we're here for you and we can take care of you the same day. Now, I'm gonna head out. If you guys have any other questions about dental crowns, feel free to call our office at 941-629-3200. Here at Olean Dental, we'll take pride of the type of services that we provide and also the environment that we provide, because this is a family and that's how we want you guys to feel with us. Have a good day.